This is Delhi, home to institutions like AIIMS, Safdarjung Hospital, Sir Ganga Ram Hospital, Ram Manohar Lohia Hospital, and many more. Delhi is known to have one of the best healthcare facilities in the country, but this wave of coronavirus has strained the city's health infrastructure like never before. What will it take to get Delhi back on its feet? Across Delhi, there are 26,000 beds for COVID patients in designated COVID hospitals. Out of this, 21,000 beds have oxygen support, and the remaining 5,000 are ICU beds. As on Thursday, April 29, a little over 1,100 oxygen beds were available for patients at various hospitals, while only 11 ICU beds were left in the national capital. Unlike many other cities which are facing the second wave of COVID-19, this is the fourth wave for the national capital. The earlier waves in June, September, and November last year did not prepare Delhi for the devastation this fourth wave would bring. Since April 18, the national capital has reported more than 20,000 new COVID cases every day. Between April 20 and April 27, Delhi has added nearly 2 lakh cases, while over 2,600 have succumbed to the disease. This was a sharp surge from the 100 to 150 daily cases and very few deaths reported in February. One more worrying factor in the national capital is the high test positivity rate. Currently, it is over 30%. That means every third person tested for COVID-19 is turning positive for the disease. Ideally, the positivity rate should be below 5%. This can be achieved through increased testing and breaking the chain of transmission. This high positivity rate is what made Delhi go under a strict lockdown from April 19th. Yet, even on April 27th, 8 days since the beginning of the lockdown, the positivity rate has remained around 32%.
I can understand most of what is happening in the rest of the country, but I can't explain necessarily what is happening in Delhi. The only explanations are the population has changed or the virus has changed. The population may have changed if you have migration. You have a lot of people coming into the city that were not there before, and those people might be potentially more infectable, as in previously uninfected people. The next is the virus has changed. Now we know that in Delhi, from the limited amount of sequencing that has been done, that we've seen an increase in the B117, which is the UK variant. We've also seen an increase in the proportion of B1617, which is the Indian variant.
Of the 3,208 samples taken from the national capital for genome sequencing, 400 were found to be carrying the UK strain of the virus, while 72 were that of the Indian double mutant.
Are these driving transmission? Are they driving disease? The UK variant, yes, we know it's more transmissible. Is it responsible for the bulk of the infections we are seeing today? That we don't know because our sequencing data is not real time. We are getting now sequences from January, February. We don't have sequences for the end of March and April. Okay, so we need real-time data to explain that. Now, is it causing more severe disease? You don't have data from previously to explain whether this is more severe disease than before. Is this just really large numbers of cases, or is this really more severe disease?
But the problem that the health infrastructure is facing is real. Many hospitals are facing shortage of medical oxygen, and several have stopped admitting new patients. Deaths due to lack of oxygen continue to be reported. Crematoria and burial grounds have been overwhelmed with the rise in deaths. The magnitude of this crisis is such that a crematorium in East Delhi had to perform last rites in parking lots. Long queues are common sight in several crematoria across the capital, with kin waiting for hours to perform the last rites of their loved ones. Civic authorities have ordered some crematoria to run round the clock to reduce the waiting period. Hospitals too have been asked to stagger the release of dead bodies. national capital is in the middle of a crisis that may very well lead to a complete collapse of its health system. The hope is that the lockdown will give some respite for the health system to pick itself back up to fight for another day.